Hi, Amy Alton here, also known as Nurse Amy of doomandbloom.net, co-author of the 22-book Excellence Award winner in medicine, the 4th edition of the Survival Medicine Handbook, plus designer of quality medical kits at store.doomandbloom.net. In difficult times, storing a good supply of long-shelf food is a wise move. Folks in the preparedness community for decades have filled their pantries and freezers with enough food to last them through any disaster. Long-lasting food items, however, can sometimes cause digestive issues when combined with the stresses associated with apocalyptic settings. One of these is sadly constipation. Constipation is usually defined as having less than 3 bowel movements a week. Stools tend to be hard, dry, lumpy, and difficult to pass. Patients often complain of abdominal bloating and discomfort, and in some cases, there's significant pain associated with prolonged efforts to have a bowel movement. Afterwards, there might also be a feeling that evacuation was incomplete. 1/6 of the general population experiences constipation, with percentages rising significantly as you get older. There are millions of doctor visits due to problems relating to it, and $250 million are spent on treatment every single year. Now, what happens to the body that leads to constipation? We absorb nutrients as food moves through the digestive tract. Partially digested food travels from the stomach to the small intestine and then to the large intestine, also known as the colon. Your large intestine absorbs water from digested contents, leading to solid feces, also called stool. When food moves too slowly through the colon, too much water is absorbed, causing the stool to become dry and hard in consistency. This makes stool difficult to move through the colon and to push out. Constipation is not a disease itself, but it can be a symptom of a number of dietary and medical problems. Common causes of constipation include diet. Constipation is often caused by failing to stay hydrated and maintaining a diet rich in high-fiber foods like fruits and vegetables. And diets consisting only of high-fat meats, dairy products, eggs, and sugary items can also possibly predispose you to having problems with bowel movements. You can see how difficult it might be to maintain a balanced diet in a post-disaster situation where the choice of foods and availability of them is limited, and even water may be limited. Prepared families often have a store of preserved foods in case of a major catastrophe. These tend to have low fiber content, which can lead to constipation. If water is rationed, dehydration may contribute to a worsening situation. Indeed, the family medic must enforce the adequate intake of clean, disinfected fluids in order to prevent the problem. Disease is another cause of constipation. Many medical conditions can cause it. GI disorders like irritable bowel syndrome or IBS, diverticulosis, obstruction, cancer, and structural defects. Hormonal problems like hypothyroidism, diabetes, and kidney disease. Nerve disorders like spinal cord injury, stroke, multiple sclerosis, and Parkinson's disease. Diseases that affect multiple organs such as autoimmune systemic lupus, and even pregnancy. Many medications have constipation as a likely adverse reaction, including pain medicines, especially opiates, non-steroidal anti-inflammatory drugs like Advil, Motrin, and Aleve, and acids containing calcium or aluminum like Tums and Mylanta, iron supplements, antidepressants, blood pressure medications, diuretics, and certain anti-seizure, anti-diabetic, and anti-nausea medications. This is just a partial list. Before a disaster knocks out medical infrastructure, you should ask your physician if meds are causing your constipation and make appropriate adjustments. Lifestyle is also a factor. Many people have habits or behaviors that predispose them to constipation. They include not getting enough exercise, irregular routines that affect the composition, timing of meals, frequent travel schedules, stress, ignoring the urge to go due to work or other responsibilities, and this is important, ignoring opportunities to hydrate. What's the right number of bowel movements to have? It's different for each person. For some, it can mean bowel movements twice a day. For others, 3 times a week is normal. In most cases, constipation is manageable with simple measures. Hydrate. You'd be surprised to know the quantity of fluids recommended by the U.S. health authorities. They determined that daily fluid intake should be 3.7 liters for men and 2.7 liters for women. Some of these fluids are present in dietary solid foods. Drink an extra 2 to 4 glasses of water a day if you're constipated. Change your diet. Add more fruits, vegetables, and other high-fiber foods to your daily routine. Eat foods known to help you go, like prunes, prune juice, and bran. Watch the number of high-fat foods like cheese that you consume daily. When you're on the toilet, be aware that certain positions are more effective in evacuating your bowels. Raising your feet, squatting, or leaning back may help. Don't spend more than 10 minutes on the toilet at a time. An excess pressure on the anus may lead to hemorrhoids. Interestingly enough, statistics show that spending time on your phone when you're in the bathroom doubles the time you spend on the toilet, which is not good. Exercise. Get moving, and your bowels may do the same. Over-the-counter options. Over-the-counter fiber supplements, stool softeners, laxatives, enemas are all options when you need extra help. And these are also useful items for survival storage. It's important to know that frequent use of these strategies can worsen the situation, so only use when necessary. Fiber supplements like Metamucil, Fibergel, Citracel, stool softeners like Colase, Surfact, oral bowel muscle stimulants like Ducalax and Senecot, laxative suppositories like glycerin, Ducalax, and enemas composed of saline solution or mineral oil may help. There are also natural options. A number of herbal teas are thought to be helpful for those suffering from constipation. They include senna tea, dandelion tea, peppermint tea, and green tea. By the way, black coffee is also commonly used to stimulate a bowel movement. I would make sure that it had caffeine though. Constipation is sometimes a sign of something worse. While most cases of constipation can be treated without major intervention, certain symptoms should alert you to seek modern medical care if available. Blood in the stool or from the anus, constant abdominal pain or distension, inability to pass gas, nausea and vomiting, fever, or weight loss. If you have constipation and any of these symptoms, get checked out while there's still an intact medical infrastructure available. This is Nurse Amy wishing you the best of health and the best of times. Thanks for watching.